Okay, as we begin to switch gears, we're a couple minutes early, but that's okay. I imagine the questions will go long form with respect to our next presentation. So we're going to be joined by Emily Campbell. There she is. Hi, Emily.
Hi.
How are you?
I'm well, thanks, Jeff. How are you?
Good, very well, thank you. Emily joins us. She, of course, is a registered dietitian, owner of Kidney Nutrition, and works at the Unity Health Network, Unity Health Toronto, pardon me, at St. Mike's Hospital in Toronto. Tonight, she's going to discuss the health benefits of supporting your PKD with nutrition changes in both early and late stages of PKD. She will identify nutrition considerations for PKD and demonstrate strategies for putting nutrition into practice for lifelong success. Emily Campbell is a registered dietitian, as I said, and certified diabetes educator with a Master's of Science in Foods and Nutrition. As I said, she is the owner of Kidney Nutrition, where she supports those living with kidney disease all over Canada through group and one-on-one nutrition support. Additionally, she works at St. Michael's Hospital in Toronto, Ontario, in the Renal Transplant Program and Kidney Stone Prevention Program. Emily is the co-chair of the Southern Ontario Canadian Association of Nephrology Dietitians and a two-time cookbook author for those living with chronic kidney disease. Emily is passionate about helping others digest the complex world of renal nutrition and supporting others in achieving their health and nutritional goals. So again, Emily, thank you for joining us tonight, and we all look forward to your presentation momentarily.
Thanks. Hello, and welcome to the PKD Summit 2022 topic, the importance of nutrition with PKD. My name is Emily Campbell, and I'm a registered dietitian and certified diabetes educator in Toronto, Canada. I'm excited to be speaking with you about the importance of nutrition with PKD because not only as a dietitian do I love talking about food, but I also enjoy eating food. And for those who have PKD, food is something that we can control when we have any health conditions. And so talking about the foods that we can eat to nourish our bodies is something I'm really excited about. The field of nutrition is always changing, and we're learning new things each and every day. But it's important that we think about nutrition as a sustainable piece to manage our PKD. We want to live many healthy years with PKD, and nutrition is one strategy that we can use to carry out throughout our lifetime. The information presented in this presentation will be general recommendations, and it's important that you speak with your healthcare provider for personalized recommendations based on your health needs and your blood work. Let's dive in. By the end of today's session, you'll be able to recognize the health benefits of supporting your polycystic kidney disease or PKD with nutrition in both early and late stages of PKD, identify some nutrition considerations for PKD and how to implement them, and demonstrate some strategies for putting nutrition into practice for lifelong success. A healthy diet can have a huge impact on PKD. Even if you have normal kidney function, it's never too early to start learning about what foods you can use to slow the progression of PKD with diet. And the top 3 things when making diet changes for PKD include sodium, fluids, and plants. When we think about PKD, it might require diet changes to help lower our blood pressure. And this might be about limiting how much salt we eat. This is probably the most important dietary change because most Canadians eat about 3,600 milligrams of salt per day, and this is way more than we need. About 70% of the foods that we eat have the most amount of salt in them, things like processed or packaged or seasoned foods. And reducing the amount of salt can help to prevent cyst growth and also manage our blood pressure. Staying hydrated by drinking the right amount of fluids can help to slow PKD's progression towards kidney failure. Fluids are the next step when we're managing our PKD, and ensuring adequate fluids and hydration early in diagnosis as well as throughout diagnosis can help to preserve our kidney function, but also manage the cyst formation growth. We're going to talk a bit more about this and how much we should be drinking in a few slides. And lastly, plants. You know, most of us don't eat enough plants, and that's things like vegetables and fruits and plant proteins. Many of us are used to eating very large portions of animal proteins. You go out for dinner and it's a 12-ounce steak or half a chicken. We live in a world that's promoted really high protein intake, and we need to start to shift our mind to think about what our body actually needs. So meeting our protein amounts, but incorporating more of these plant-based proteins because they help to manage our urine pH and the load on our kidneys. We're going to talk a little bit about, which vegetables and fruits to choose. And early in our diagnosis, our blood work might be okay in terms of potassium. And so we might not need to make any diet changes based on the types of vegetables and fruits we're having. But the big goal here is to really increase the amount of vegetables and fruits that we're having. These also have a lot of soluble fiber, so they can help with, our bowel movements, help with our cholesterol, our blood sugars, and also help for weight management if that's also a goal for you. The PKD diet overall is a really healthy diet that focuses on eating a lot of vegetables and fruits while limiting large amounts of salt, sugar, and protein. Nutrition is important for people with PKD for many reasons. A healthy diet can help slow the growth of cysts, ultimately slowing the decline in kidney function. It also can help to control side effects or common conditions that are related to PKD, like high blood pressure, edema, acidosis, heart health, stroke, and kidney stones. And a healthy PKD diet can help with all of these factors. There's a common medication that might be used with PKD called tolvaptan or Janarc. And this can slow the worsening of kidney function in certain patients with ADPKD, which is that inherited type of PKD. And this medication is a unique class because it works on the vasopressin receptor agonists in our body. So basically, it increases the amount of water released from the body as urine and decreases the growth of cysts. Removing fluid from the body and slowing the cyst growth helps to slow the progression of PKD. But nutrition can also do the exact same thing. And so we've been learning more and more each day and each year about nutrition for PKD. For many years, there weren't really specific PKD recommendations, but we now know that nutrition can help to slow the cyst growth and formation. Nutrition recommendations for PKD are very different than other kidney conditions like CKD. And so it's only been in recent years that we've seen this increasing knowledge in nutrition for PKD, and we continue to learn. A few years ago, we didn't even know that there were nutrients that can help. Now we know that focusing on things that can help to reduce the cyst growth and formation, just like the medication can, but also manage things like blood pressure, blood sugar, and cholesterol are really important. So it's important that we get the right amount of nutrients to maintain our health and also our kidney function. And a renal dietitian can help you put together a personalized approach. But the main things to focus on are fluids, sodium, protein, and then we'll talk about a few other key considerations. But it really boils down to our plate, incorporating more of those plants. So aiming for half of it in vegetables, a quarter of it in protein and incorporating more plant-based proteins, and then a quarter of it in starches or carbohydrates. And we'll talk a little bit about what that looks like with PKD and the current recommendations. The first way that we can help to minimize or reduce cyst formation and growth is through fluids. Water should be the first choice, like clean, filtered water with no sodium, no sugar, no artificial sweeteners. Individuals who might be on tolvaptan get very thirsty and might be recommended to drink more than 3 liters per day. And this should really be individualized. But more fluid intake helps to lower the vasopressin, which is that antidiuretic hormone, and can help to minimize cyst formation and growth. So a common recommendation for those who have PKD is to drink water, and a lot of water. Some would even recommend 3 to 4 liters to help to minimize that cyst growth. It's important that you speak to your healthcare team to find out exactly how much you should be drinking, because this might be more than what you're used to. And there are some risks when we're drinking high amounts of fluids. So basically, making water be our beverage of choice and spacing it out throughout the day is important. So if we're drinking 3 liters a day, having a certain amount at breakfast, lunch, and dinner and in between meals can help us to meet our fluid goals. Flavoring our fluids with lemon, lime, fruit, or herbs is also important. Most of it should come from that good old water, but it can be plain. So that's why adding in some of those fruits or herbs are fine. Unsweetened or unsweetened beverages like bubbly or LaCroix, or PC sparkling Blue Menu water might be other great ways of getting some carbonated changes into your diet. We want to try to limit our coffee to about 2 cups per day. So there's been some newer research looking at fluid and coffee and caffeine on our on cyst formation. And what we've seen is that coffee doesn't have a significantly statistic increase in size on our cysts, where it's 2 cups per day. So one reason to still allow you to include it into your diet. Certainly things like limiting our juice, our pop, and drinks with added phosphorus in the label is really important. We're going to talk a bit about sugar and carbohydrates, but I talk about avoiding, artificial sweeteners because of the gut and the kidney connection. There's not too good of an effect on artificial sweeteners on our gut. And then, of course, limiting added sugars like juice and pop is really important. How much fluid you should be drinking really depends on your 24-hour urine collection. And this is something that your physician can help you with to determine the osmolarity of your urine and help to delay that cyst growth. The next thing we'll talk about is sodium. And so sodium is something we're always worried about when we have any kidney conditions. And no sodium is not better than low sodium. So there's still a role for some salt in our diet to help manage our electrolytes, especially if we're drinking large amounts of fluid. We worry about having any low electrolytes. Really, we want to try to limit sodium to about 2,300 milligrams or less to help manage our blood pressure and reduce our cyst formation. And, remembering that most Canadians consume around 3,600 milligrams of salt per day, making some small changes can really help. So whole foods are going to have less sodium in them naturally. And when we have PKD, we might have very sensitive hypertension. Certainly, with a lot of salt, the cyst expansion can also occur more likely, and therefore progression of disease. High salt in our diet, it makes that vasopressin release again. And so by starting a low sodium diet early on, that can manage our blood pressure and disease progression. A 24-hour urine is a really great way to see, again, that osmolarity and how much salt we're having, but getting started with that 2,300 a day can be really helpful. One way we can do that is to read food labels. So when we're looking at the food label, taking a look at the serving size, so on the example here, it's 1 cup, and understanding that this might be more or less than the portion that we're actually having. And on the right-hand side of the nutrition facts table, looking at the percent daily value. So generally foods that have 5% or less means there's a little bit of something, and 15% or more means there's a lot of something in that product. And if we're talking about sodium, we want to try to find foods around that 10%, so just in the middle there. And that would be a low sodium diet. So 10% daily value is a really good target for sodium on any of those products. We can flavor our foods with fresh herbs and spices. We can cook low sodium by using low sodium broths or sauces. And food skills, cooking at home more often can help us to reduce those processed foods. It takes about 14 days for our taste buds to get adjusted to low sodium. So, stick with it. And foods will and can and definitely will taste great by adding in those herbs and spices, or using things like leeks or onion or garlic to flavor our foods. Trying to reduce those processed or packaged foods at home can be really helpful. And one thing with salt, a big challenge is weekends or celebrations. So eating out might often occur more on the weekends, or higher sodium diets if we're preparing or eating foods that are prepared outside of our own home. And so label reading is a really great way of looking for low sodium things. Things that might be breaded or seasoned or sauced at restaurants tend to have a bit more sodium in them. Or offering to bring meals to social gatherings can help you to choose lower sodium options as well. The next thing is protein. So high intakes of protein can cause the hyperfiltration with the kidneys, which causes increases in blood pressure and can change that urine osmolarity as well as the vasopressin, but also cause a high acid load on our kidneys. So it's important for us to have protein because it helps us to maintain our muscle mass and fight infection. But too much of our protein increases blood pressure and can increase the risk of cysts developing. And too little protein can cause muscle loss. The right amount of protein, it's based on things like our height, our weight, our activity level. And a 24-hour urine can help us to estimate how much protein and find that sweet spot for us. Compared to CKD, those with PKD don't need to follow a low protein diet. There's been some studies on low protein and plant-based diets showing promising recommendations, but there's not a concrete guideline yet. And really targeting what the average Canadian needs for a protein in our diet is important. A reduction in protein, which we would follow with CKD, something around the 0.6 grams per kilogram, is not recommended with PKD. And a dietitian can help you calculate exactly how much protein you need. When we think about protein, that source of protein is also important. So we want to include more plant-based proteins because this helps to improve our heart health and manage our blood pressure. There's a lot of benefits to plant-based eating, especially because animal foods have more uric acid and are more acidic. And animal proteins, they can also be higher sources of saturated fat in our diet. Reducing our animal proteins and choosing more plant-based can also help with weight loss with PKD. It's really about a personal choice with proteins and how much and how often you might be incorporating some of these plant-based proteins. Maybe you start with, a meatless Monday, or maybe you focus on having a vegetarian meal every day at lunch for the week. Incorporating more plant-based proteins into our diet is great in terms of overall health, but can also help with PKD. Some other considerations when we have PKD are things like carbohydrates. This is probably the most controversial area in PKD world, and some animal models have shown that when glucose was removed, and that's what a keto diet might be looking at, and ketones were used as that primary source, the cyst formation was managed and slower. And this was related to something called beta hydroxybutate production. But right now, there's not too many good human studies, and so following a keto diet with PKD has not been a concrete recommendation across the board. And, as a dietitian, I really like to look at ways that are sustainable for us and things that we can do for a lifetime. And often we find with keto diets, they can increase the risk of cardiovascular disease, kidney stones, and liver cysts, but also, with a keto diet, it might not be sustainable because of the additional things like monitoring ketones, tracking our intake. If we're traveling or going out for dinner, those can all be barriers to continuing to follow a keto diet for long term. So right now, there's not a lot of a concrete recommendation on following keto diets with PKD, but we do know that there are some really awesome opportunities for studies coming out of even University of Toronto in the upcoming years to see what keto and PKD diets can look like for patients. But when we think about sustainable diets, we really want to think about the quality of carbohydrates and the portion size. So incorporating more whole grains can be really helpful for keeping us full, which can help with weight management. Also gives us a lot of really great nutrients, and then portion size. So remembering to try to keep it to about the quarter of your meal. So the quality, so what types we're choosing, and also how much we're having them. Something else to think about is that, added sugars. And so things like honey, maple syrup, table sugar, these are all those added sugars and things that we want to limit overall for our health, but also for things like inflammation in our body and choosing more natural sugars like fruit instead. We already talked about what the artificial sweeteners can do with our gut. So something we want to minimize as well. And hyperglycemia, high blood sugars, is associated with a faster disease progression. And so limiting these added or refined sugars from our diet is important. And the whole grains that we get from whole grain breads and rice, not only are they lower in glycemic index, so they help to control our blood sugars, but they can also help to reduce risks of diverticulosis, which is also common with PKD. So more fiber helps regular bowel movements and also can help to control our cholesterol levels. Phosphorus is another thing that comes up a lot with the kidney world. And with PKD, it's really individualized based on blood work, but something we all can do is avoid those added phosphorus foods. Added phosphorus tends to be found in a lot of packaged or processed things. And so when we think about overall health, we really want it to be a balanced diet. Potassium is certainly individualized based on our blood work. And really the only kind of fruits or fruits, I guess, that we need to avoid, and this is really only if you're on tolvaptan, is grapefruit or grapefruit drinks, or supplements like St. John's wort, because they can interact with medications. But when we think about potassium actually helps to manage our blood pressure. And so that's why we incorporate a lot more vegetables and fruits. And so aiming for half of our meal in vegetables and fruits can help to control our blood pressure. It also helps to keep us full, and also can help to manage our cholesterol levels. So unless you've been advised to follow a low potassium diet, there's no need to worry about potassium with PKD. Oxalates are another thing that we might want to consider. And so individuals with PKD are at increased risk of forming kidney stones. And so our urine really does tell us a lot of information about personalized recommendations for oxalates. And individuals who have PKD and are forming kidney stones are more likely to progress quicker. Oxalates are not a great science. There's a lot of misconceptions because there's not a lot of great data on it. It really depends on where the food was grown. There's really only one or two accurate lists. And then it really looks at what the research is really saying in terms of oxalate contents. The biggest thing with oxalates are gut management is super important. And so keeping things moving, keep minimizing constipation. And with oxalates, a lot of them come from plant-based foods. We know that plants are very alkalizing, which is helpful for managing the pH of our urine, helps to preserve kidney function. But then oxalates can increase our risk of forming kidney stones. And so not everyone who has PKD needs to avoid these oxalate-containing foods on the screen. But what it's important to know is if you are at risk of forming kidney stones, these might be the most common foods that could put you at risk. So you might be asking, what should I do? And really, nutrition should be a personalized approach that is sustainable. And when we think about PKD, it's really about these few key things. So body weight control. So we want to look at moderate calories. So limiting processed foods because they're high in salt, fat, and phosphorus sources. Managing our protein intake in moderate amounts. So choosing plant and or animal proteins if you'd like. Low in sodium and glycemic load. So meaning we're choosing foods that are low in salt and sugar, high in fiber, and high in water. And you know, when we think about it, something that might be sustainable is a Mediterranean or the DASH diet. When we think about these, PKD requires diet changes to help lower our blood pressure, and this looks at limiting sodium. Staying hydrated and drinking the right amount of fluids also helps to slow PKD progression. Eating high quality proteins in smaller portions can help to protect the kidneys. And if the kidneys are becoming damaged, you know, understanding potassium and phosphorus is important. But a key issue with dietary management of disease is compliance. And especially when non-compliance doesn't result in immediate or serious adverse consequences, we often go away from following diets. Having assessments of, you know, our targets, working with a dietitian, looking at our blood work, our ultrasounds can help us to see how we're doing with our diet. But when we think about sustainable habits, it's something that we're going to be able to do for a lifetime. You know, PKD is a long-term condition, and we want an eating pattern that's something that we can stick with, regardless if we're at home, if we're traveling, if we're out for dinner, and understanding the basics of what our body needs. The Mediterranean diet is an evidence-based diet pattern that looks at increasing fruits, vegetables, whole grains, legumes, nuts, seeds, and heart-healthy fats. It focuses a lot on that whole foods, so making vegetables that main part of our meal. This diet could possibly be one of the healthiest in the world. It's not a strict meal plan. It's rather a way of emphasizing enjoying whole foods and regular physical activity, thinking about ways that we can incorporate more vegetables into our meals, like adding kale to a smoothie or putting some cucumber and bell peppers onto a sandwich, or maybe having apple and some pistachios as a snack instead of crackers and cheese. You know, the Mediterranean diet talks about swapping red meat for fish. So fattier fish like salmon, trout, mackerel. These are big sources of the Mediterranean diet. Not only do they have omega-3 in them, which reduces inflammation, but it can also help with cholesterol health. And we know that heart health and PKD go hand in hand. Olive oil is the main source of fat with the Mediterranean diet, and it's a great unsaturated fat, which can help to lower the risk of LDL compared to things like butter. Things like nuts and avocados are high in those poly and monounsaturated healthy fats as well. They also have protein and fiber to help keep us full. And so when we think about the overall quality of a Mediterranean diet, incorporating more of these whole foods is great, not just for our kidney health, but also for our heart health. And certainly the Mediterranean diet looks at limiting processed foods, added sugars, refined grains. These should be restricted. So, swapping white rice for whole grains like bulgur or barley. These have a great amount of fiber in them to help manage our blood sugars and our cholesterol, and it can help with weight loss as well, but also great sources of B vitamins. Beans and legumes, they're a big part of the Mediterranean diet. These plant-based proteins, they're lower in saturated fat compared to animal proteins as well. And then with the Mediterranean diet, it limits processed foods like cookies and refined flours and sugars, and incorporates more fresh fruit to satisfy those sugar cravings. Whereas something like the DASH diet, it's really about another approach of managing blood pressure through incorporating things like vegetables and fruits and whole grains and low-fat dairy products, fish, poultry, beans, and nuts. And the biggest difference between the DASH diet and the Mediterranean diet is this more focus on dairy products with the DASH diet. It focuses on those whole grains because they're lower in glycemic index to help control our blood sugars. They have lots of fiber to help keep us full. Things like oatmeal, a really great source of soluble fiber. Lots of vegetables, incorporating them at each meal, focusing on fresh or frozen vegetables, whether you eat them cooked or raw. Same with fruit, incorporating those in every aspect. Limiting those things like high saturated fat foods like fatty meats, so red meats, beef or pork or lamb, and focusing more on the fish, chicken, and plant-based proteins like tofu, lentils, chickpeas, nuts, and seeds as more of this balanced diet. The DASH diet also incorporates olive oil as a fat source and focuses on limiting those sweets to only a couple of times per month. Really, the DASH diet and the Mediterranean diets are really the healthiest diets in the world because they're not a strict meal plan. It's a way of eating that emphasizes enjoying foods and regular physical activity that have been shown to improve blood pressure. And we know that if we can improve blood pressure, it can also help with cyst formation with PKD. So you might be asking, what is left to eat then if we're adopting some of these eating patterns? And nutrition is something that's much more than nutrients in food. It's impacted by our socioeconomic status, our access to cooking and tools and facilities, our food skills, as well as our time to prepare meals. And so finding foods that are similar to what you're already eating, but adopting them to be more of a Mediterranean or DASH diet pattern, it doesn't need to be complicated. So, here are some examples of what balanced meals might look like. Some oatmeal with low-fat milk and cinnamon, apple, and sunflower seeds at breakfast. Lunch, a tuna wrap with some tuna, lettuce, cucumber, bell peppers, and maybe some berries. Maybe you have some whole grain pasta at dinner with chicken, or maybe you use chickpeas if you're interested in plant-based eating, and a salad, and then a snack of some pistachios and grapes. These meals have lots of color and lots of delicious foods with PKD. And encouraging healthy eating, it doesn't need to be confusing. Start with those vegetables and fruit. Choose healthier sources of fat like olive oil and nuts and seeds, and look at your protein. So incorporating more plant-based proteins and looking at our portion size of protein is important. Understanding where we are with our nutrition and looking for small ways that we can make changes is a great way of starting. There's really not a one-size-fits-all approach to nutrition. And so if you read things about keto or plant-based diets, certainly there's not a concrete recommendation for them yet, and what works for one person might not work for the other. But most importantly, it's really trying to make small nutrition changes and gradually to help with compliance. We can't go from eating no vegetables and having a very high salt diet to following a Mediterranean or a DASH diet each day. And so thinking about small changes that we can make will help. And remember that PKD is a lifelong thing. So any changes we can make in our diet that are sustainable can help. So looking at our plate, incorporating more vegetables and fruits, looking at our protein sources is really important. Start small. Focus on one meal that you can work on each week. So maybe that's dinner. Looking at different ways of preparing your foods. So maybe you use crock pots or sheet pan meals to help incorporate a bit more vegetables while you're cooking your proteins. Using easy strategies like bagged salads or already portioned and washed vegetables and fruit to help increase these on your table. And taking a look at some sustainable changes that we can have. So maybe you focus on adding a vegetable at lunch each day. Next week, work at dinner, aiming to have half of that meal in vegetables. Especially at lunch and dinner, it's a little bit more difficult to get vegetables at vegetables at breakfast. Sometimes we have fruit there. Using frozen or fresh vegetables are a great way of also incorporating some easy ways of getting fiber. If we're incorporating carbohydrates, remember it's that consistency piece and choosing those whole grains. So portion size and which ones we're choosing. And then trying to limit our animal proteins. So trying to keep that portion size around that deck of cards, especially if we're eating large animal portions already, and incorporating it into a bit more plant-based proteins. And then the sodium piece. So reducing sodium through using, seasoning spices like PC Blue Menu, McCormick's, or Clubhouse. They all have no added salt seasonings, or Dash. Looking at no added salt canned vegetables or broths. Not adding salt when we're cooking rice or pasta or hot cereals, choosing plain vegetables and seasoning themselves with fresh herbs or spices, and reading those food labels for sodium. So looking for that 10% daily value. And remember that when we're making nutrition changes, it takes a little bit of time to get used to these habits. And so stick with it, find a community that can help you, like the PKD Foundation, and really, understanding that these changes are for a lifetime. There's lots of support out there in addition to the PKD Foundation. So registered dietitians are trustworthy and credible sources of nutrition information. And many of your extended health insurance plans can cover registered dietitian services. So you don't actually need a doctor's referral to see a dietitian. And there's many renal dietitians that can help support with PKD. Understanding your personal needs and your goals based on your blood work, your urine tests, because those really help dictate that personalized nutrition approach. So to meet your needs, to help you plan meals, and really delay the progression of PKD. So nutrition, it plays a very important role in managing cyst formation, and getting started with small changes can make a big impact overall. So thank you so much for listening. I'm really excited to answer some more questions about nutrition with PKD.
And we're back. There you are, Emily. Thank you so much for that wonderful and highly insightful presentation. It's amazing to have seen the change of interest in nutrition over the last number of years, obviously, right? I want to start by just talking about kind of changing the patient's mindset when it comes to nutrition, because for a long time, when a patient would see their nephrologist, it was the obvious, your water intake, keep the salt off the table, monitor your alcohol, don't smoke, varying opinions on the caffeine factor. And that was really it. There wasn't dialogue into the benefits of protein by animal versus vegetables and the ilk. So I can imagine a big part of your job is to break that old cycle of thinking, right? And getting people to recognize all of the information that you touched on and the importance of nutrition. Can you just speak to what you do to kind of educate and change that paradigm?
Yeah, so I think it's multifaceted. Nutrition is such a new area of health, and we're learning more and more every day. 5, 10 years ago, we didn't even know that nutrition needed to be different for CKD versus PKD. The other aspect of nutrition is we all eat. So in some sense, we're all experts in nutrition. And we need to understand that there's what the evidence says, and then there's also that personal approach. And so my role a lot of times is certainly dispelling those myths, but also working with individuals to find something that works for them. Because with PKD, it's something that we'll have for many, many years. And we want to keep that progression. We want to keep the kidney safe for a really long time. And so something that's going to be most sustainable and what works for that person might be different than the next person.
And you touched on that a few times in your presentation, and we heard it in last night's presentation with Dr. Kay and Dr. Wimes speaking about ketogenics and that component. It's taking your diet in steps that you can manage and not getting overwhelmed by trying to dive 15 steps ahead, and making those small changes is vital. And like anything, whether it's exercising, practicing meditation, or diet, it's that consistency of routine that builds long-standing habits, right? So very important takeaway from your presentation. We obviously know the vital impact that water plays on PKD patients. And of course, the recommended intake is quite high, or can be for some PKD patients. For those that just getting their water intake, you've provided some ideas of how to change it up. Can you just speak a bit about what you maybe recommend to get people to, again, break that cycle of maybe not drinking enough water, and tips and tricks that you may have in making it a bit easier for them?
Yeah, I like a strategy of having a particular cup or a bottle that you use all the time. Yep. And the size of it is going to differ. Mine's convenient for me because it fits in my purse, it fits in the cup holder in my car. So finding things and strategies like that break down some barriers is really helpful, but also getting yourself on a schedule. So, waking up in the morning and having that bottle beside your bed or a glass, making sure you're getting some right even before you get out of bed, and then trying to separate it throughout the day. That way you don't ever feel like you get to the end of the day and realize, oh my gosh, I'm 1.5 liters short, and then you're up all night peeing. So spacing it out and then adding in those flavors helps us to drink it a little bit better.
Great. I know you mentioned the varying water bottle sizes. See some PKD patients and tolvaptan patients with the big big 1 gallon jugs that they go through. So it's definitely a case by case basis, of course. We're leading up right now, of course, into the holiday season. Lots of Christmas parties, holiday parties, staff parties. More eating out than usual. Recommendations on knowing that people will get a little bit lighter in the dietary regimen over the holidays, but not overindulging. Can you just speak to kind of how to stay mindful through the holiday season when nutrition plays such an important role?
Yeah, good question. So I think moderation is definitely the most important piece. One meal is never going to make or break your diet or any of the progress that you've made. And these celebrations and holidays, they're not always here. So it's okay to deviate a little bit from your diet, but also knowing, some of your restrictions. So for example, ham. Ham is quite high in sodium. If we'd normally have, quite a large piece, maybe we just try to have half as much. If we'd like to try maybe 5 desserts, maybe we have a smaller portion of each of them. So that moderation piece is key. The other thing is, when we're going to events like at restaurants or things like that, looking ahead at the menu to see if you can make a lower sodium choice, or calling ahead just to ask the chef to maybe make some modifications. And if we're going to other people's houses, it might be offering to bring, a dish that is PKD friendly, or providing some of your dietary needs to whoever might be preparing the meals. Because just like if we had any allergies or intolerances to food, our diet modifications for PKD are just as important. So.
Right. And you touched on portion control. I mean, I was just traveling for a conference in the United States, and was eating out at restaurants here and there, and there were times when I was leaving enough food on the plate that looked like an entire portion of a meal. So I think that that's definitely something that North America really needs to step up in recognizing a proper portion and what that represents, because when we hear these presentations and you're talking about the deck of cards and certain size facets, we know that that's not remotely met when you go out to restaurants or you travel to certain countries and places like that. So,
exactly, yes.
Very important takeaways.
And our plate sizes have also grown so much over the last few years too.
Right. You mentioned the 14 days, and this is kind of just a comment I wanted to bring up, the 14 days to get used to lowering sodium. I hadn't heard that factor before. So obviously, when you go from seasoning with salt and a variety of different seasonings and then trying to lower that, 2 weeks can seem like a long time.
Mm-hmm.
So do you have recommendations on seasoning options that may help to curb the 2 week time so that it makes it more manageable?
Yeah, so starting slow is always a great strategy. Any little bit of decrease in sodium is moving us towards our goal. So if we would maybe make our dish with a whole teaspoon of salt, which is already about 2,300 milligrams of salt right there, maybe we break it down to about 3/4 of a teaspoon. And then in a couple of other days, we make it down to half a teaspoon. And so that gradual change can be helpful, and we don't notice it as much of going from 0 to 100. I'm a big fan of dried herbs or spices. So whether it be things, like Dash seasoning or PC Blue Menu, McCormick's, Clubhouse, they all have no added salt ones, which are just the dried herbs. You can also buy the dried herbs. So whether or not you get them at the grocery store, or I love the Bulk Barn because you can get a little bit of all of the different ones. And they store great for months. Another thing is using things like vinegars. So balsamic vinegar or red wine vinegar are really great ways of adding in a bit of flavor to our food that are low sodium as well.
Great, thank you. Dive into some of the questions in the Q&A box. Donna asks, how can we eat more plants when we're told to avoid lots of beans and legumes? She finds that particularly challenging by going meatless. And then she touches on additionally that she was also told to avoid whole grains and to eat white bread, white rice, etc. Well, can you just clarify a bit of the talking points here from Donna and elaborate on the recommendations? You did touch on, kind of introducing meatless Mondays and kind of just changing a day or a particular meal, kind of ease into transition. But specifically to Donna's inquiries, can you elaborate?
Yeah, so I'm not sure who gave you those recommendations, Donna, or your blood work. So it's hard to say why someone or who told you those things. Usually when we think about PKD diets, we think about incorporating these whole grains and plant-based proteins because they have such a good benefit on the kidney. Some thought could be behind, oxalate content in things like chickpeas or lentils or legumes or tofu. However, the portion size matters most. Half a cup of chickpeas or lentils is still considered a low oxalate food. So if that might be the reason they were thinking about that. The other thing with chickpeas or lentils or some of these plant-based proteins is they are often thought to be higher in potassium. So if you were recommended to have a potassium restriction, that may have been why you were told to avoid these foods. But we now know that there's this great new research among the bioavailability of potassium, and we know that we actually don't absorb as much as we used to think, and that has to do with our gut health. But if you are on a potassium restriction, actually the canned no added salt chickpeas and lentils, they actually have a lot less potassium, so they certainly can be included if you are on a potassium restriction. But with PKD, we don't usually see potassium restrictions in patients. And especially even when we do, it's usually really late stages into the disease.
Okay, thank you for that. Sandy points something out, and we'll get some clarification from you. And then just for those in attendance, I will put the link to the webpage that Sandy's talking about into the chat for everyone reference. She says, I notice on the PKD Foundation of Canada's website that there's a diet page from BC Renal, a collaborative effort between BC Renal and our foundation. It encourages alternative sources of protein, for example, soy milk, edamame, tofu. She goes on to say, I thought females particularly were supposed to avoid high estrogen foods, PKD and PLD. Please clarify this.
Yeah, so there has been some things about polycystic liver disease and estrogen foods, particularly if you have PKD with polycystic liver disease as well, and mostly related to the hormones. However, if we're just talking about PKD patients, there's no need to avoid some of these plant-based proteins. In fact, they're lower in saturated fat, which is great for our heart health. So edamame, tofu, those sort of things can certainly be included in moderation.
Okay, thank you for that. Alex asks, you mentioned chickpeas. Are they okay for potassium restrictions? He goes on to say he's avoiding potatoes and chips because of the salt, but chickpeas are a mystery to him.
Yeah, I think we kind of touched on this a little bit. So certainly when we think about plant-based proteins, they're great overall for PKD, and trying to limit the animal proteins, chickpeas can be a great alternative. I find the canned ones, no added salt, quite convenient. You can put them, mash them up and put them into a sandwich. You can put them in a soup this time of year, salad. Those are all really great ways of using them too.
Okay, thank you. Touch a bit about the importance of community. Obviously, having a group of like-minded individuals to lean on and to learn from is invaluable. We preach that quite often. There's a variety of really great informative Facebook social media groups and things like that. There's cookbooks that you haven't yet plugged yourself. So, I mean, of course, take this time to talk about your cookbooks and other recommended books that may be out there for added resource. And then what is your thought about the apps, like food tracking apps and calorie trackers and things like that? Can you talk a bit about the added resources to keep people on the straight and narrow?
Yeah, so I think we need community and we need support whenever we have a chronic illness. And not only does it allow us to learn from other people's experiences, but it also provides us with support and a network and a community to just collaborate with. I think that there are amazing opportunities, whether it be through the PKD Foundation, through the Kidney Foundation itself. I've been seeing a lot of local organizations, and certainly with the bust of social media, there's a lot of other great communities there. And I mean, I am a healthcare practitioner and I'm not living with PKD. So looking for support, whether it be from a community member who might be an advocate of PKD, from the healthcare side, or from someone living with PKD, are both really great support systems for you. I think that when we think about, what we can do with that information, is knowledge is power, but also knowing that everyone is an expert when we eat. And so taking things with a grain of salt is also important, depending on what we're reading.
Great insight. Thank you for that. When we had a renal dietitian join us once before, they had said something that really stuck to me, and it was about going grocery shopping, and how in most stores, sticking to the outer perimeter allows you to stay closer to the healthier foods. So the fruits and vegetables, the dairy, and other healthier sections, and then the sugary stuff, the less healthy items are in the center. Is that something that's still relevant? Have you heard that before? Is there a tip I know not to go to the grocery store when you're hungry. I know that one firsthand.
Yeah.
A lot of bad decisions are made, but are there any tips and tricks about when you're out there other than reading the labels and being very mindful of the ingredients?
Yeah, I have heard that before, but I would disagree. I think that there are still a lot of really great things in those middle aisles. That's where we might get, our canned legumes. That's where we get our nuts and our nut butters. That's where we find our whole grains. And so there are still some good things in those middle aisles, and it's not always necessary to completely avoid them. And even that being said, we're going to have some of those special foods once in a while that might be a little bit higher in sugar, but it's that moderation piece. And I mean, I love food, and so I can't tell someone not to ever eat something. It's all about how we can incorporate it. But some strategies when you're grocery shopping, I love the idea of not going in hungry, because that's when we tend to buy impulse purchases. But the other piece of it is trying to make a list. So, thinking about meal planning is really knowing what foods and when we need meals throughout the week and planning ahead. So when we go to the grocery store, we're buying the foods that we need. And with the cost of groceries going up right now, going in with a list can help us to only purchase the things that we need for the week. Using different apps like Flip is a really great app that has all of the grocery flyers on it. If you don't get the flyers to your house, or looking online on the websites is a really great trick as well. But also buying in season foods. So certainly in the summer, we grow a lot of stuff here. We have more greenhouse things now in the winter time. But buying in season is also going to be a little bit less expensive as well, and might get you to try some new foods too.
Thank you. Donna just clarifies a bit from her points made earlier, that she's not allowed beans, and this is what she was told in her kidney clinic. As you had mentioned, Emily, she thinks that that her caregivers think a PKD diet is a CKD diet. So that's something to be really mindful of, is the variance that's ever present now. And again, it's a constantly changing, evolving part of PKD care, right? Nutrition, things are always coming out. And of course, we heard last evening about the possibility of results coming from the human trial with the keto clinical trial out of Toronto General Hospital. So as things progress, the foundation, the other support organizations that Emily mentioned, will of course be sharing up-to-date information as it evolves. But again, as I emphasized earlier on, I think it's great that nutrition is finally getting the attention that it deserves, because patients can really notice a positive impact in prolonging the quality of their life by making these healthy decisions.
Yeah, it's a great time to be learning about nutrition. So.
Heather asks, what do you think about temporary fasting? As an example, eating only between, say, noon and 6 p.m.
So there have been some studies looking at time-restricted feeding or intermittent fasting with PKD. I feel like it's a personal choice. One useful thing with intermittent fasting is if we feel like we're constantly eating, that intermittent fasting can be a strategy for that. However, there's not any good evidence in fasting for longer than 16 hours. So you should have an 8-hour eating period and a 16-hour fast. Longer fasts, like not eating in more than 16 hours, can put us into starvation, and that's not something that we want. But I will give a caveat that if we are thinking of intermittent fasting, it's important to speak with your nephrologist or your dietitian, because there could be some supervision that might need to be made with medication timing, and just making sure blood sugars are stable.
Definitely, I think it can't be overstated, the importance of keeping your nephrologist up to speed. And a lot of these PKD specialty clinics that are popping up, of course, have the inclusion now of a renal dietitian as part of the multifaceted care. And I think that is such a huge stride for patient care and support services that was long overdue. So tremendous to see that they're actually working together now and recognizing that everyone has to work together for the best interest of the patient's care. We have a few more minutes left, Emily. Donna is asking if you're taking new patients. So do you want to talk a bit about the support services that you specifically provide, maybe where people can find you after this presentation if they want to get connected?
Certainly. So you can find me over on my website, which is emilykidneynutrition.com, or over on Instagram at kidney nutrition. So I do work with individuals one-on-one. I am accepting new clients right now, but there's information on my website to send me an email. I'm more than happy to chat. I do a lot of CKD, but also PKD work in my private practice. And I really do take a food first approach. I'm sure you've seen tonight of how we can, make a diet that's sustainable for people.
Amazing. And so when we send out the post-event email with the links to all of the presentations from the PKD Summit 2022, we'll be sure to include your resources as well as part of an additional support measure from this topic today.
Thank you.
We'll put out a last call for any questions from individuals as we begin to wrap things up this evening. A lot of information provided tonight. And again, I think it's very important to emphasize again that when changing your diet and when looking to make positive changes, that you take it in those piecemeal steps. Recognizing that, if you go gung-ho, and we're all have fallen victim to this before, that all or nothing mentality, right? And wanting to dive in and go full tilt, and then you end up burning out on the diet or the exercise routine. A lot of people then go backwards, and it's important to take it in moderation and to take it in strides that you can manage for the long term, right? I think that's very important that you've touched on.
It's about progress, not perfection.
I love it. That's a wonderful way to end on. Okay, Emily, thank you so much for joining us this evening. It was fantastic getting to know you and learning about the support services you provide. Thank you so much.
No problem. Thanks for having me, Jeff.
Have a great night.
You too.
Okay, so that will conclude this evening's event. You'll see in the chat box that Marie has just provided the evaluation link. So we would appreciate anyone still on the call this evening to submit your opinions of this evening's event. It helps us adapt and grow and make next year's summit even greater than this year's was. All of the recordings, as I mentioned, will be made available. We will be sending out an email on that shortly with respect to them being posted. If you have any other questions or comments, please reach out to us either on social media or through the website. It's been fantastic getting to provide these events and presentations to you over the last 2 weeks. And we look forward to doing another event in the coming weeks. Thank you again for joining us tonight, and I wish you all a great evening. Take care.